Our biggest problem for the past 5 years since I've been involved in presenting these cases was space. When you're talking about cases that are $20, $30, $40, $50,000, and you have a dentist saying, oh yeah, you should do a full, double hybrid, you should do fixed. It almost becomes, it's like the patient sitting there going, I really want to do this case, but I'm not interested in buying you a Porsche. If someone wants to be able to have implants and pull them out and clean them, you're not going to recommend an all-on-4.
Try to help other people get what they want. And generally speaking, you'll get what you want, but you got to focus on the other people first. Welcome to another episode of the Full Arch Advantage podcast. I'm your host, Gary Bird. I'm the founder of SMC National, where we help you create, convert, and close more full arch cases so you can grow the way that you want. But you can't grow if you don't know how to get patients to say yes in the chair. And today I have one of the best joining us, Stacy, who is a case and finance manager at her one office that's doing over 80 full arch cases this month. And you're going to be blown away by some of the things that she shares because it's not what most people are talking about in the industry. She's going to share some very practical advice that will help you get your practice to where you want to go and make sure that patients are getting the treatment that they need. Stay tuned. All right, Stacy. So why don't you tell me just tell me how many cases you guys are doing a month, or how many starts or arches, however you guys measure that, and kind of what the size of your organization and what you're working with.
Yeah, so that's a great question. We actually our biggest problem for the past 5 years since I've been involved in presenting these cases was space. So we were working with 6 ops. One was hygiene. And at that point, we were roughly doing about 500 to 550 a month in collections.
Wow.
So I got together. So this is actually my dad's former practice. A doctor named Dr. Valadez bought the practice from my father. The one thing we needed was more space. We literally had no space. Like, we couldn't even fit leads in. We were just so we got together, we took over the suite next door, and we literally in January just finished, we added 3 new surgical suites, and my office. I have my own office back here. It's, the consultation room. And now we are this year, we're projecting to do about 8 million in collections, in one office. So we're doing, you're going to think this is a little crazy. We're literally doing about 70 arches a month, whether it be, full fixed, or we also do removable over dentures.
How many locations? I heard you say you had multiple offices.
One.
Just one location?
No, this is one location.
Got it. Okay.
We just did a build out. So we took over the suite next door and we combined it. So we have one sterilization unit. So it just walks through, so it's all under one
place.
And
and are you the one selling all those cases? Are you the one kind of at the center of all of them?
Yep. I pretty much take on any case that's over, $5,000. We have a treatment coordinator up front. My title is case and finance manager. And so any full arch, or even we'll sell, $25,000 GP cases with IV sedation. We just, it was interesting because when my dad owned the practice, he basically, had his office manager presenting the cases, and they were converting at about 20%. And I have a 20-year sales background. And I basically stumbled into the industry, and he said, I have something for you. He said, he didn't want to put me into that role. I had a lot to learn. He said, I'm going to teach you. We're going to look at these x-rays, and I'm going to teach you about these cases. And you call those 80% of people that we aren't closing, and I'll just pay you a commission on the cases you close.
Wow.
And that's how it started.
You want to hear something crazy? Dental marketing agencies are dead. You got that right. They're dead. Why do I say that? Well, we don't consider ourselves a dental marketing agency. We are a growth partner. What that means is we help our clients not only create opportunities, but we help them convert them and close them as well. And that is what's needed in the day and age that we live, because just getting new patient leads is not enough. You need somebody that's going to help you actually get these new patients into your chair and make sure that they're the right kind of patient for your office. Now, we put together a whole report that will tell you where dental marketing currently is, because there's a ton of changes, tons of things are going on with the market. And we broke down what you're going to need to do to stay ahead of the industry and grow the way that you want. The link is down below. Go check it out. Everything is free. I look forward to hearing from you.
That's so cool.
Yeah, isn't that crazy?
That's absolutely crazy. And this is why I love having these conversations, because everybody has these stories, but yours is obviously unique to you. In 70 cases. So we got the right person on the show today. You were referred to me to talk to. And I'm really excited to kind of talk through that, because where are you getting those 70 people? I know you guys are in San Diego, but how do those people find you to even get those 70 opportunities to get to do treatment to every month?
Yeah, it's interesting because, and I find this a lot because I do some consulting for dentists to help them kind of transition from GP to full arch. And one thing you hear all the time, and I feel bad for marketing companies, is like, the marketing's not good. It's, you know what? And I always say, it's not the marketing. Marketing brings you opportunity. It's what you do with the opportunity that brings you money, obviously.
Okay, wait,
so
guys, just so everybody's clear, I did not pay her to say this. I did not script this for her. This is not something I told her to say. This is like 100% first time we're talking. But you're like, I say it differently because I'm a marketing company and I can't just come out and say that. But I'm like, hey guys, there's a lot of opportunities for marketing to fill along the way before they get to your office. And they're the hardest patients to get a yes from by far.
Yeah. And so it's crazy how much missed opportunity is going on out there just for, in dentistry. It's like, dentists don't know sales and they weren't trained on that. And they don't really understand the whole sales cycle and lead calls. And so it's a tricky thing. And I realized, real quick, I'm going to get back to your question, but when the new dentist bought the practice, his name's Dr. Valadez, he put me in the role of actually presenting the cases. My dad didn't want to rock the boat. His office manager had been doing that for years. Dr. Valadez was like, hell no, you're presenting these cases. And my conversion's like 80%. I mean, I obviously have a sales background. I have a passion for dentistry. It's in my blood. My father was a dentist. And I would sit in on surgeries with Dr. Valadez to learn the knowledge, read books and diagnosis. I learned as much as I could. But to answer your question, how do we get these 70 cases a month? So you should be spending about 10% of your collections on marketing. But it's crazy. Most people, I don't know. I'm just looking at, I know some of the big players like in San Diego and Orange County, and you have offices that are doing $1 million a month, but they're spending $200,000 in marketing.
Yep.
We spend about $40,000 a month in marketing. It's a combination of TV,
which is not a ton. And it's a lot of money for one practice. I will say that, but it's not a ton of money for the amount of cases that you're seeing.
No, we're this month we're projecting to do 800,000. So that's 5%.
Small. It's on the smaller side of the budget. So how are you getting that many patients in then for that amount of budget? Are you getting a lot of referrals or?
Well, no, it's not even that. It all boils down to the conversion. Mm-hmm. So it's like, I only see 4 patients a day, but if I convert 3 and they're high-end cases, you see what I'm saying?
Yeah.
So I see some, yeah.
So let me ask you this. So why, in your brain, compared to everybody you've seen, everybody you've talked to, you kind of understand the dental industry, why are you getting a much higher conversion rate than other people? What's your secret sauce, so to speak?
Yeah. So one thing I've noticed is, and I feel like it's a big thing, is, and a lot of these companies too that are training, because, there's so many people claiming to do wonders for dental offices, and I'm going to increase your full arch acceptance and this and that. And it's like the dentist, they're trying to tell the dentist to sell these cases, which almost becomes a conflict of interest, because I'll tell you why. When you're talking about cases that are $20, $30, $40, $50,000, and you have a dentist say, oh yeah, you should do a full, double hybrid, you should do fixed. It almost becomes, it's like the patient sitting there going, I really want to do this case, but I'm not interested in buying you a Porsche. Whereas if the dentist looks at the CT scan, evaluates the bone density, says, these are your options, you have the option to either do a denture, an overdenture, or a fixed hybrid zirconia bridge, and just is non-biased and just present and explains, the features and benefits of each. And then they come see me, and I talk to them, and tell them. And it's also just one of my favorite sayings of all time, is cost is only an issue in the absence of value.
Yep.
Ever.
Yeah. Yeah. For everything. So let me ask you this then, because I think you're on to something. Are you saying like a lot of because there's a lot of doctors out there that only do full arch, right? They don't do any kind of options, right? They're not like, there's even whole surgical centers that are all based off of that. They won't do a fixed denture. They won't do multiple implants. They only do full arch. Are you saying that is a conflict of interest, or could potentially be a conflict of interest because it's not really giving the patient the full medical options that they have in this complex scenario? Is that kind of how your brain is kind of processing that?
It's always like a rule of thumb in sales. You always want to have like more than one option. I know a lot of these DSOs and clear choice stuff. I think it's a profitability. They just don't have the profitability with like doing overdentures and things like that. I think now a lot of them are switching and doing those. But yeah, I think 100% unequivocally, it's better to have more than one option when you're trying to sell a big. Speaking
case. Medically, and again, I'm not an expert on the medical side or on the clinical side, but just from a patient's perspective, if I broke my arm and they were like, "Hey, Gary, you got 3 or 4 options. We can reset it. We can put a cast on." You know what I mean? And they give me, I want to know all my options. I don't want to just know one of my options or the most expensive option. I want to know, okay, what are each of the options? What's the cost? And then what's the timeline that I can expect from this as well? Because there's pros and cons to all of those treatments, I imagine. So having those options, I think, is huge. So you feel like that's really helps you convert more cases because you are giving people more options?
Well, yeah. And then, need plus feature equals benefit, right? So it's like, if someone like wants to be able to take out their dentures and clean them, we don't sell lower dentures because a lower denture is a disaster. You always need implants on the bottom. A lower denture is a nightmare. It flops all over the place. But if someone wants to be able to have implants and pull them out and clean them, you're not going to recommend an all-on-4. Most of the time, because a fixed prosthetic is it's so much, it resembles natural teeth and you have better chewing capability. Most people, will choose that option if they have the means, to get there. But yeah, it's definitely good, I feel like, to have 2 options. But, you have to talk to the patient, probe them, find out what they're looking for, and then come up. It's kind of like it's not even like I'm selling something. I'm literally it's like a dance we're doing together to figure out the best option and how we're going to get there. I don't get objections. I don't have someone say, I can't afford that. It's more like, how are we going to get there? Do we need a cosigner?
Yeah.
So it's like,
well, let's walk through that.
You have to overcome all the.
Go ahead. I'm sorry. I didn't mean to cut you off again.
Go ahead. No, go ahead. I was just going to say, like, you overcome the objections. Once you ask for the money, then it becomes really weird. Then you don't want to start overcoming objections. So you have to ask questions throughout the sales presentation. So there's 2 presentations. There's a clinical, when they meet with the doctor, shows them all the options, and then there's a sales presentation. And during the sales presentation, you have to figure out what they're looking for, what they're currently going through, what are their pain points. You have to does your wife know that you're here? Is she supportive? Right?
Are you sneaking around on your wife getting dentures without her knowing?
Yeah. Yeah. But I mean, that's going to alleviate at the end, the patient saying, oh, I have to go talk to my wife. If he says, yes, she's 100% in, she knows I'm doing this. You know what I'm saying? Like because once you start talking money, it becomes weird if there's objections.
Do you, so number one, so you'd say the number one thing that you credit to closing cases for you is that you have options. What would be a number 2? Is it financial options, or is it really just working through the objections prior to them presenting them? Or is there something else? I wouldn't say the number one thing is that I have options. I'd say the number one thing for me, if you had to ask me that question, how I've been able to do so well in this field is, I'd say, my ability to really connect with the patient and make them understand that I'm trying to help them. You have to think about people versus profit. You have to put them first. And it's like, there's a saying like, what's the saying? Like, people don't care what they know, but I totally lost. I think people don't buy from who they know, they buy from who they like. Is that it?
Well, yeah. Well, it's people don't care what you know. People.
Oh, people,
totally
I know which one
forgot
you're
it.
talking about. People
But
don't
no,
care what you know. They care if you care about something like that,
yeah,
right? Yeah.
okay, that's what we're trying
Yeah.
to get. It sounds like that. But no, I heard something, and this is actually from my father, and he said something that kind of resonated with me. And he said, um, people will forget what you do for them, but they will never forget how you make them feel.
Yeah.
And so you ask, how am I successful? Obviously, I have 20 years of sales management, sales training experience. I have the passion of dentistry, but I figured out what works, right? So it's like, I see a lot of these, like, I'm not going to name names, but these big institutions, like other marketing companies doing these big, you know, you know who I'm talking about. And I've seen them actually critiquing like a sales presentation and the things that they're telling these doctors to do. It's like, it's so off. Like, find out how much money they have up front. Like, that's the last thing you should be focused on is money. Like, the money will come. Don't focus on money.
Yeah.
Focus on helping the patient.
So funny. Yeah. I always tell people, like, our kind of motto is just in general, my motto in life is like, try to help other people get what they want. And generally speaking, you'll get what you want, but you got to focus on the other people first. And so, yeah, if you always focus on money, then everything's always going to be about money. And that causes a lot of problems. The other thing is if you're just in this business or any business just for money, you might be able to get it. You might be able to get the money, but I look at money as a byproduct of doing things the right way. If you do things the right way, whatever you do, it could be dental marketing, it could be a case acceptance, expert, or it could be working on a construction site. If you do a good job and you always have a level of excellence that you're trying to achieve, money is just the byproduct that shows you that you're on the right path, right? Is that kind of how you think of it as well?
Exactly. And if you listen to someone like Jeff Bezos, like if you've ever listened to like what he talks about, like what his biggest vision for Amazon was, his number one thing always is be like client centric, like customer service. Make
it easy, right? Just make it easy. Make it so like almost you don't even recognize that you're dealing with a middleman when you're buying all this stuff.
Exactly. And that's another thing that we do here at New Day Smile. It's like, because I know if I promise these people that they should be choosing us over the other 10 offices they go to, like we are the ones they need to come to. If there's something that goes wrong, guess who they come to? They come to me. So it's like, that's one thing, my dad instilled in this. He said, we're a people practice that happens to do dentistry. So we just take really good, we don't nickel and dime people. We don't try to upsell people. We have our own lab. So that's one thing, Dr. Valadez opened a lab. So the profit is, once you start doing a lot of arches, that's definitely something that, doctors should do. Yeah. Because
it makes a huge difference,
and then, and then just the communication, because, you have the clinical presentation, the sales presentation, and then the execution. So you have to, when they come into the office, you have to all be professionals. People can tell. You have to know your stuff. You have to be trained. You have to be organized. You have to have systems in place. So that's really important too.
Yeah. So you said earlier that there's some people in the industry that kind of focus on the wrong areas. What are some other things that you've kind of seen in the industry that have become standard practice, but that it's really not probably the right thing to get the kind of results that you guys are getting?
Yeah, I would say the main thing is like we had talked about, like not understanding. And like even I was listening to one of your podcasts earlier, and a doctor was talking about different things that were important. And, it never mentioned like the sales part of it, which is like, if you can't sell these cases, you're not going to do them. You can be the best surgeon in the world.
Yeah. You
know what I'm saying? So understanding like how valuable and compensating, you find the right person.
Keep them.
Yeah. You pay them because, if that person were to leave, it could be catastrophic for your practice. So I teach that too, like how you compensate. I mean, it's very, bonus and, it's a base plus commission, and then you work your way up but what are some other things that they're doing wrong is maybe try one thing that blows my mind is a lot of these doctors are really focused on opening multiple locations and missing so much money that they could be making in the practice that they currently have, right? So it's like, it's kind of like, it's interesting. When my dad was practicing, you couldn't even own more than one practice. It was illegal.
Yeah. Yep.
Isn't that crazy?
Yeah.
And now it's like, it's kind of like, I know the DSOs and all that stuff, but yeah, it's like, there's so much missed opportunity in probably a lot of these offices that they could be made with less overhead, right? Because anytime you open another practice, it's more overhead.
It's more overhead. Yeah. It's more fixed cost.
So,
yeah. And a lot of people mix because there's growth, but there's different ways to grow. There's growth by addition. So adding more cost, more labor, more buildings, more rent, more marketing, more everything. Or there's growth by optimization, which is almost never adding more labor. It's actually usually cutting back a little bit on labor, adding more systems, adding more processes, adding more AI or different tools and things like that. And it's amazing what you can do when you really focus on optimization. The other thing that I've seen really popular, I would love your thoughts on it. And it's okay if you don't have an opinion on it. I'm seeing a lot more people doing like the hub and spoke model, where they'll have one specialty office at the middle, and then they have like 2 or 3 GP offices around it, where the GP and then they market for GP only, and then the GP patients come in, which is much cheaper than marketing for full arch, and then as full arch opportunities come in, they refer back to themselves. Have you kind of seen people doing that?
Well, yeah. So it's funny that you asked that, because Dr. Valadez has this office, which is our implant center, and then he has 2 GP offices.
Okay, perfect.
So, but it's a little interesting. We're trying to kind of figure that out, where we could we're in the process of doing that, where they could, it's like when you have 2 other offices and 2 other managers, and they all kind of bonus on their own, it's sometimes hard to get that whole like referral system working perfectly together.
Yeah.
But yeah, I have seen that, and that works well. We kind of do it opposite. We do most of our marketing for full arch, and then they just do like some digital marketing and stuff for GP. But in a perfect world, and we just hired a new manager and one of the other GP practices. So, and then we're going to bring in like an oral surgeon to do, if we have to do, we don't do zygomatic implants here, but we do sinus lifts. But yeah, so we're trying to get that whole, but I think, that could be really successful. And if you have a good referral system, and that could be great.
Stacy, this is number 1, you're really good. And number 2, we could probably talk for a lot longer. Would you mind if I
agree.
Would you mind if I sometime, and it doesn't have to be soon, I know you're busy and you have like work to do. And I know you also don't directly benefit from this. I know you're just doing this like literally out of the goodness of your heart to help other people. So would you be okay if sometime in the future I scheduled like an hour conversation that we could talk more in depth about like your patient journey and those kind of things?
100%.
Thank you so much. Like really, 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 most people who are in your position do not do what you're doing right now and I get it, because they're like, I'm busy, I'm closing cases, we're growing, why would I tell everybody else? But there's so many people out there that are trying to do this, and their teams are getting trashed, and everybody in the process is just like, it's all broken. And so I'm so thankful that someone like yourself like takes the time and go, no, guys, you can do it. It's just hard, right? There's a lot of moving parts to it. So I really appreciate you coming on and doing this.
No problem. Thank you so much for having me. I look forward to talking to you soon.
Awesome. Thank you so much. Bye-bye.